Along to our next presenter, and our next presenter is Alexis Schmierer. And Alexis did her practicum with the Missoula Public Health in the Health Promotion Division. And her site mentor is Jacqueline Klein, who is the Substance Use Disorder Prevention Coordinator there. And the name of Alexis's presentation is Navigating Local Parenting Support, Simplifying and Meeting Family Needs. So take it away, Alexis.
Hi, everyone. My name is Alexis, and this is my AP presentation. This last academic year, I served as a graduate research assistant at Missoula Public Health as part of the University of Montana's partnership with the health department known as the Academic Health Department. This collaboration funded my position to help support ongoing projects. I worked under the Substance Use Disorder Prevention Coordinator, Jacqueline, to help on various projects, which also helped fulfill my integrated learning experience, ILE, in the fall semester and applied practicum experiences, APE, this last semester. I worked on a grant that the Healthy Start Missoula received from Montana Children's Trust Fund, using the grant's deliverables to meet my academic goals. I also wanted to give a shout out to DPHHS, who gave me a stipend for working at the health department this last school year. So the competencies that I said I was going to work on, foundational and concentration specific, qualitative data collection. I did this through conducting parent interviews to gather qualitative data on parenting or parent seeking support behaviors in Missoula County. Stakeholder identification and engagement. I did this by identifying key stakeholders of parenting support resources and built partnerships to enhance the project's outcomes. Communication of public health content. I did this through the development of a comprehensive report targeting professionals in the parenting support network, communicating the research findings, and promoting awareness of parenting support services. Communicate, promote, and advocate for health in the profession. I did this through creating the final report of the project's deliverables and presenting that to professionals in the field. Evaluation and research related to health promotion. I accomplished this through conducting interviews and evaluating Missoula's current parenting support system. So I conducted interviews. The participants that we wanted to learn from were parents that were 18 years or older with children that are aged 0 to 5 that currently live in Missoula County. We were able to screen those who weren't eligible to participate through Qualtrics. So last semester, I worked on my ILE where I did a literature review on investigating appropriate ways to develop a parent survey. From that research, I was able to guide the interview question development. We also had a question development advisory meeting with other professionals in the field to gain feedback on the questions. Questions were designed to be clear, concise, and help us understand how, when, and why parents are seeking help during a challenging time. So originally our goal was to conduct 3 parent focus groups with 5 or more parents per session. This didn't really work out, and I will talk more about this in the next slide, but this is our approach and how we originally went about conducting the focus groups. Once the potential participant took the screening survey, they were invited to provide their contact information. From there, we used Doodle Poll to coordinate the best time for them to participate in a focus group. We utilized Healthy Start Missoula's coalition members to help spread the word about the focus groups and hung up posters all around town. So challenges encountered. Out of the 57 screening survey respondents, only 20 of them provided contact information. And of that, 10 indicated availability for a focus group. Despite our efforts, only 1 participant attended the scheduled focus group session. So recognizing that the potential challenges of recruitment for parents for focus groups, we then decided to pivot to individual interviews. We also updated our process in connecting with parents to scheduling meetings using Calendly. Calendly lets us connect our meeting platform like Zoom to our calendar and allowed parents to sign up at a time that was easiest for them, putting the meeting automatically on my calendar and sending them an invite and reminders. After doing this update, we were able to conduct 13 successful interviews. So coding the interviews, there was 7 questions that we asked during the interview, and here is an example of how we went about coding this qualitative answers. For example, how parents found programs. This was the main code, and it was broken down into subcategories of healthcare providers, and that included like lactation consultants, counselors. It's also broken down into online searches, social media, word of mouth. The subcategory was identified, like in the example, like our doctor's office recommended a group. You can see on the rest of the tables how we broke down the coding. I also wanted to note that the answers could have been coded multiple times. For example, in this question, how parents found programs, they indicated that there's several different ways that they went about finding programs. So their answers could have been coded multiple times in those subcategories. So I'll give you a second to look at those. Moving on. So I'm going to share some of the data points that we found. Where do parents go for support? This pie chart shows where parents turn to get help. Our analysis highlights the multiple avenues where parents turn when they need support. The data categories support seeking behavior into these areas. Family and friends at 27%. Healthcare providers at 19%. Again, this included doctors, counselors, lactation consultants. School system resources was 2%. Parenting support programs was 19%. And this included mentions of programs like Welcome Home Baby or Family First. Social media was 16%, and this included podcasts, Facebook, or other social media platforms. And finally, internet searches was 17%. Why are parents seeking support? Parents are seeking support for a range of reasons related to child behaviors, which was at 33%. This included tantrums or wanting to find activities that are developmentally appropriate for their child or wanting to get tips on how to transition for sleeping. Breastfeeding and nutrition support, this was at 17%. This included parents needing support with latching or concerns about their milk supply. Child health concerns was at 22%, and this included mentions of sickness like hand, foot, and mouth. And wanting parents' mental health support was at 17%, and this included wanting support for postpartum depression or other mental health challenges. And then finally, wanting to connect with other parents was at 66%, just parents wanting to find other parents facing similar parenting challenge. This chart shows that there's a diverse motivations of driving parents to seek assistance. And finally, parent-driven criteria for an ideal parenting support community. In this bar chart, we see the criteria parents said what would make up their ideal parenting support community. Themes from these parents' responses were categorized as accessible support. This included mentions of wanting programs that are accessible in terms of the content of the program and open and want them to be more open to other different types of parents outside of the ones that programs are specifically designed for, like programs with parents struggling with substance use. Education and information sharing, parents indicated that they valued the type of education that they would receive in the programs and also wanted to connect with other parents to share advice and resources. Community engagement and social interactions was the biggest criteria for an ideal parenting community, where parents wanted to have community events that fostered social interactions with other parents like themselves. Parents also valued non-judgmental support. This would include wanting a safe space where they can share their challenges. There was also themes of wanting childcare assistance. This included wanting support for childcare so they could participate in the program or just in general having more support for childcare in their community. And finally, technology integration for support. Although few mentioned it, I think it's important to include because it's something that we already have access to through programs like Lifts or Bright Text, a community where parents can rely on technology to help access parenting support resources. So all this data and more will be found in the final report. As I said in my proposal, one of the deliverables was supporting the creation of a final report for the grants project. There are other grant deliverables that I've been helping support, like helping putting on 3 professional training events, implementing a parent survey, where we'll collect more data similar to the questions that we asked in the interviews, and also help design an infographic. All of these deliverables have in will be outlined in the final report. So next steps for the project include presenting the preliminary findings of the parent interviews at a training session, which we actually just held last Monday. Then presenting the final findings at the last training session, which will be held either May or June. We plan to share the report with the community partners that helped us throughout this process and also with the participants of the interview and the survey. The grant will be done at the end of June, and if you have any questions or want to see the report, I would be happy to share that with you once it's finalized. But that is the end of my presentation. Thank you.
Nice job.